Hi everyone. I'd like to share the findings from our recent study examining sleep quality in semen barometers in a cohort of nearly 300 healthy young men. While a lot of previous research has focused mainly on how many hours people sleep, we wanted to understand whether how well people sleep might actually matter more. The key finding from our study is that sleep quality is strongly associated with semen parameters. In particular, men who reported symptoms of poor sleep, like daytime sleepiness or difficulty sleeping, tended to have worsened semen parameters. These included lower sperm motility, poorer morphology, and a reduced total motile sperm count, which are important indicators of fertility potential. This suggests that a good amount of sleeping isn't enough. What also matters is having restorative, good quality sleep. So, what might be driving this relationship? We think several biological mechanisms are likely involved. First, sleep disruption can interfere with the body's hormonal balance, particularly the hypothalamic pituitary gonadal axis, which regulates testosterone production and spermatogenesis. Poor sleep can alter the normal pulsatile release of key hormones, ultimately impairing sperm production. Second, sleep disturbances are known to increase oxidative stress, which means high levels of reactive oxygen species, which can damage sperm cells, affect their function, and even trigger apoptosis. Third, circadian rhythm disruption can affect hormones like melatonin and cortisol. Elevated cortisol, for example, can act as an endocrine disruptor and negatively impact reproductive hormones. These pathways likely work together, making the relationship between sleep and reproductive health multifactorial. Now, an important question is, are these changes reversible? While our study was cross sectional and doesn't directly test interventions, there's reason to believe that at least part of this effect is reversible. Sleep is a modifiable lifestyle factor, and improvements in sleep hygiene could potentially improve reproductive outcomes. There is also some indirect evidence supporting this idea. For example, studies in other contexts have shown that treating sleep disorders like obstructive sleep apnea can improve hormonal balance and reduce oxidative stress. Since these mechanisms are closely linked to sperm health, it's plausible that optimizing sleep could lead to improvements in semen parameters as well. However, we still need well-designed interventional studies to establish a clear causal relationship and quantify how much improvement we can expect. To conclude, our findings highlight that sleep quality is an important and often overlooked factor in male reproductive health. For clinicians and patients alike, this opens up a simple but potentially impactful area for intervention, improving sleep habits. Better sleep may be an important step toward better reproductive health.